Hello, my name is Brad Belt. I'm the today's host of Toki Talk, and welcome to this latest episode. Joining me today, I'm extraordinarily fortunate to have them with us, are Melissa Frank, who is the Executive Director of the Barrier Islands Free Medical Clinic, and Dr. David Petersheim, who is the Medical Director of the clinic. Welcome, both of you. Delighted to have you here with us today.
Thank you.
I had the great good fortune of having you host me, along with a fellow council member, Russ Berner, at the clinic recently. Extraordinarily impressed by the great work you're doing on behalf of the community, and we wanted to share that with the broader Kiowa community. Perhaps for those who don't know what the Barrier Islands Free Medical Clinic is, maybe a quick overview of what it is all about.
Yeah, so we're a free medical clinic on Johns Island, and we're right on Maybank Highway, centrally located on the islands. And we provide a medical home for adults who don't have insurance. And we're really excited because we just expanded our qualifications for care to now include any adult in Charleston, Berkeley, or Dorchester County who qualify with our financial limitations. So we provide primary care services just like any internist or family practitioner would. The only difference is that it's completely free of cost.
Anything you want to add, Doctor?
Well, I think adding that it's a multi-specialty clinic, so the 19 primary care providers can refer internally to our remaining 22 specialists in various specialties that are useful for the person to get follow-up actions on their eye disease, their women's health issues, their orthopedic needs, their mental health needs, their dermatologic needs, and other very important specialties as well, that they can keep that internal control of their health within the same building where, again, all of those consults are done for free. And I think the other thing to add in is that we can use the support of the Roper St. Francis system to get free diagnostics in terms of labs and x-rays that are at no cost to the patient, so that we can better diagnose their diseases and treat them, follow them, and if need be, refer them to specialists at Roper Practice Partners or the Stormy Institute for complicated procedures to correct those conditions which we diagnose in the clinic.
Want to come back to the important work of the clinic in just a moment, but first I want to ask about each of you. What led you here? Melissa, you first. Why are you at the Barrier Islands Free Medical Clinic?
Yeah, so I've always been involved in healthcare. I'm a physical therapist is my background, and when I did a residency down here 11 years ago, I fell in love with Charleston, and I knew I wanted to come back one day. So about a year and a half ago, I started looking for job openings in the Charleston area, just very casually, and came across a job opening for Barrier Islands Free Medical Clinic. And the more I read about the clinic, the more I became interested. And when I came down to visit for a tour of the facility, I was absolutely amazed. It's a way for me to still be involved in healthcare, but on a much broader scale, to truly give back to those in a way that I've never been able to before.
Very good. Doctor, how about you?
I trained in heart and lung surgery and taught at Penn State, and then came to do private practice at Roper for 15 years. And my wife and I moved to Costa Rica for a year with our twins that were in the 7th grade. And I started doing free medicine there in a clinic called La Clínica Cristiana in La Carpio, which is a barrio in the middle of San Jose. And that free medicine experience was quite impressive to me, and the impact that that you have as a provider, the skills that you have, and how much it's needed by people that don't have access to any insurance. So when I came back to town, I started volunteering at this clinic for 7 years until I became the medical director about 3 years ago. And I enjoy the role of a Sherpa that guides people on their journey up the mountain, you know, and it's good to know the path and to help people get where they want to go. And so I'm grateful to be on that journey with patients.
Well, speaking of patients, let's talk about your patient base. Who are your patients, and what types of services do you provide to them?
Well, our patients are all adults, 18 to 65. We do have some older patients that are visiting their adult children that are also our patients from other countries. So our oldest patient's actually 88, but they're only a small fraction are above 65. So there are about 950 patients we follow right now. The main ethnic group is the Latino group, followed by Caucasians, followed by African Americans, and it's about 52, 35, 25, or 20 something. And we do bilingual services through 2 interpreters that are bilingual. Some of our providers speak Spanish as well, either by training or by heritage. And we have bilingual forums to help people in that other language, Spanish. Our patients need to catch up because they've been using urgent care and emergency rooms for their care. And by spot welding their care, they get some care, but they don't really get consistent care. So our goal is to bring them along with adult vaccines that they may need and other chronic disease management. Guidance about nutrition is essential. Some of our patients can't read. Some of our patients can't write. And so identifying them in a culturally sensitive way is a challenge because you don't really realize that until they've made a couple mistakes that can only be explained by that, and they don't want to talk about it because they're adults. And so who wants to admit that?
When we were visiting, we met with one of the staff
Yeah.
who showed all her,
Samaya.
Samayu, who has her pictographs.
Yes.
It's a way to communicate regarding symptoms, treatments, when there are those communication challenges.
Absolutely.
Your patient base is low income. So you do have income test or qualifications. It's not just anybody can come in. This is focused on providing service to those who otherwise can't afford those services.
Yeah, so in order to qualify for care, our patients can't have insurance and they must be in a household income of 299% or below of the federal poverty levels. So those change on an annual basis, but for a single person in 2024, they can make just over $45,000 and qualify for care.
And how often are you seeing your patient base? You said 900 patients. I mean, is it like once a month? Is it once a year? What's the kind of the tempo, depending on obviously what their issues are?
The average patient comes 3 or 4 times a year. Some patients come considerably more than that, but the average is 3 to 4 times a year.
Let's try to connect. Oh, actually, I want to ask, in addition to the patients, about who provides the care. Where do those people come from?
Our providers that volunteer to give services are retired physicians predominantly. There are some actively employed nurse practitioners and DAs and some actively employed physicians. They're partnered with largely retired volunteer nurses, although there are a small cadre of employed nurses that also volunteer. And they are coupled with a larger group of administrative people that are essential from the entry, the fundraising process, and the coordination of all the activities that it takes to count medicines and reconcile papers and justify this and get ready for an annual audit. So it's an aggregate of 140 people, only 10 of whom are employed, and the other 130 are volunteers. So we're reliant on this low-cost model that was the idea and brainchild of Charlie Davis and Arthur Booth, that a low-cost model of healthcare was possible.
They founded the clinic, and when was that?
They founded the clinic in 2006.
2006.
Yeah, with that idea that if they got enough volunteers and paid a few people, that those activities could collectively lead to medical homes, and that's what we're trying to bring to bear.
Do you have all the volunteers and service providers you need, or are there other areas where you could use assistance?
We're always looking for more volunteers, whether that be on the clinical aspect, providers, primary care providers, ophthalmologists, gynecologists, or nurses. But also on the flip side, we have a lot of administrative and front desk volunteers. So you could truly have never worked in a medical facility ever before, and we truly have a job for everyone and anyone that's interested in getting involved.
Well, so let's talk about the connection of the Barrier Islands Free Medical Clinic to the Kiowa community. A lot of people probably don't appreciate the fact that a lot of the people who work on this island are actually some of your patients. That's one connection, and maybe you can talk a little bit about that. And then also in terms of your leadership, financial support, and others, there's a Kiowa connection.
Yeah, so over 60% of our current patient volume live in the 29455 zip code, but we know there's a significantly higher percentage of our patients who work on Kiowa, whether that be through the hospitality industry or service industries, through cleaning, through landscaping, through trade service jobs. And currently we provide a medical home for 120 employees of the Kiowa Island Golf Resort as well. So we definitely see quite a few patients who live or work on Kiowa, and additionally, a lot of our volunteers, a lot of our donors live on Kiowa as well.
Well, your leadership, your board chair is actually the town's administrator, Stephanie Tillerson, and I believe there are other board members that have strong Kiowa connections.
Yeah, we're extremely fortunate to have Stephanie as our board chair. Dan Whalen as well serves as our vice chair. We have Tom Nevin on our board, Pat Shedler, as well as Ryan Knitzer on our board as well.
Well, for those of you who don't know, Tom Nevin runs the Kiowa Island Club, and Dan is the president of the Kiowa Island Real Estate Company. Ryan Knitzer is the chief of the St. John's Fire Department District. So how does it all work economically? Because you've got a very nice facility. Even though there are volunteer services provided, you have to maintain that facility. You have to pay the 10 staff. You have to acquire medicines and things like that. Where does the money come from?
Yeah, that's a great question. So we do not take any federal or state funding whatsoever. We do not charge our patients. Everything is completely free of cost at our facility. So all of our funding comes through three sources, and that's through private grants, which we're extremely fortunate that we've received a grant from the town of Kiowa for quite some time, which is very instrumental in our services. The other two sources are through our annual fundraisers, all of which also take place on Kiowa Island. And the third is through individual donation.
Let's talk about those fundraisers. What's coming up?
Yeah, so we have our last fundraiser for 2024 coming up on December 4th. It's our Fashion for Our Cause fashion show, and that'll be taking place at the River Course Ballroom.
And are still opportunities for people to...
So we did sell out.
You did sell out. Well, congratulations on that.
In record time. However, if you are interested, we have a waiting list. So you can go to our website, www.bifmc.org, and go ahead and sign up for our wait list, and also sign up for our newsletter so you know when future events are.
And when would be the next event if you missed this one?
Our next event will be on June 2nd, 2025, and that is our annual golf tournament, and that'll be taking place at the Ocean Course.
The Ocean Course. I assume you will that one will sell out as well.
We hope so.
Okay, very good. So what is the future? How do you see the future of the Berry Islands Free Medical Clinic? I mean, as they continue to grow and expand, I know you've expanded your geographic footprint. Are there other things that we can look forward to in the future?
Well, I would say having a larger provider base, more specialties, a better way to see more patients in that building. There's space in that building to add additional clinic rooms if our patient volumes exceed the 10 examination rooms that we currently have. Having better systems in place to diagnose early onset of disease, such as a retinal camera, to identify diabetic change before it causes the dreaded complications of ruptured vessels in the eye. So incorporating more technology that costs money to help people along is critical. The other thing we'd like to do is improve accessibility to our clinic. If anyone can help us get a bus stop on Maybank Highway, that will greatly increase the chances of someone getting care at no cost if they can ride the bus at an affordable rate, because they share rides. They get
CARTA
to us.
does not provide service there.
Unfortunately not, but that would be very helpful. So better services, better connections through transportation, better use of technology, more providers, more administrators, and fill that building up, build out.
Are there any particular anecdotes or stories that, whether it's patient related or otherwise, you said this really exemplifies what the clinic is all about?
Well, there was a fella that he is a dock builder, and he was managed for a basal cell carcinoma of his eye the inferior eyelid of his eye, and he was diabetic, type 1 diabetic, and he was depressed, and he didn't want to do anything about this slowly growing problem below his eye. But over time, a number of us convinced him to do the steps necessary, and we got him through our Exceptional Needs Fund and the actions of the Mohs surgeons and Storm Eye Institute, excised that and grafted in a skin that not only cured him of the basal cell cancer, but prevented the complication of encroachment on his eye that would have killed him. And he graduated from us at 65 and with a nice looking result. And I wish I could tell you that was the only example. Quite frankly, every month we get somebody that has some story. But I'm touched by that fellow because we got him over kind of the acknowledgement that he had something he really needed to deal with. It took multi-specialty effort to get him to where he did in a multi-institutional method with some support from us, but some good, honest contribution from the community as well to get him really what was a curative thing. So I think that's a pretty good example.
Well, it is a great example. And on behalf of the town of Kiawah Island, the Kiawah Island community more broadly, thank you for the extraordinary work you do on behalf of your patients and the entire community. We look forward to continuing our dialogue and our partnership. And everybody, please go onto the website, participate in the upcoming events, and show your support for this great asset to our Kiawah Island and Johns Island community. Thank you very much for joining us for this latest episode of Toki Talk.
This concludes another episode of Toki Talk. As always, we encourage you to sign up for the town's weekly e-blast, follow us on social media, and participate in or watch our town meetings online. We look forward to seeing you at upcoming town events. Thank you for watching, and stay tuned for more podcasts to come.